There are a lot of conflicting findings and reports on the effectiveness of annual mammograms. In October, the American Cancer Society released new guidelines for breast cancer screening. Among the changes, the new recommendations say all women should begin having yearly mammograms at age 45 and can change to having mammograms every other year beginning at age 55. The guidelines were published October 20th, 2015 in the Journal of the American Medical Association. Though not everyone agrees on how often to screen, the specialist at Florida Hospital Waterman's Digital Mammography Center emphasized that screening in and of itself is still the best way of catching breast cancer early.
I think it's very important for women to realize that as part of your yearly health maintenance is that, yes, you see your doctor, but you should have your mammogram done because it's part of the routine standard of care for women. First, the patient will have a mammogram, will decipher what's going on, and then they'll have an ultrasound. How ultrasound helps us is that if we see a mass by the mammogram, to further characterize the mass, if it's cystic or solid, the patient will have a dedicated, focused ultrasound of that area. So if we know it's a cyst, the patient can go to see us next year for the routine screening. MRI comes in a few places. Number one, it's very useful for patients who have biopsy-proven breast cancer to take a look both at that breast to see if the breast cancer is limited to that one site or to other sites in that breast or has spread to the axillary lymph nodes. Or sometimes we picked up breast cancer in the opposite breast that was not even seen by the mammogram or ultrasound. So that's a very important tool that the surgeon should have before operating. The other areas where we use it is that if we see what we call as a density in the breast that's abnormal in one view, sometimes if it's a new finding from the previous mammograms, we would use the MRI and see, is it an area of abnormal enhancement based on the enhancement curves and kinetics, or is it just breast tissue and we can follow it closely. Mammograms, unfortunately, are uncomfortable, but the digital mammography we perform here with the soft pad does help. And I do encourage you to get your mammograms because 85% to 90% of breast cancer can be picked up by mammogram.
For more information about Florida Hospital Waterman's digital mammography services, follow the Effective Screening Story link on our homepage at yourhometownhealth.com.